Whether you want to find out if a heart attack is on its way or you've already had a heart attack and need to rehab and make some changes, Modern Heart and Vascular Institute will meet you where you are to make you better. Dr. Percy Morales shared how they focus on everything from preventive measures to diagnosis and aftercare. Dr. Morales, the #1 killer of men and women around the world is heart disease.
Yeah.
Yet there are so many things that we can do to make it not the #1 killer. And part of that is lifestyle and prevention.
Right, Deborah. I mean, lifestyle prevention is so much important feature of managing heart disease. You know, when patients want to do well for a long period of time, whether that's preventing heart disease or even people who have had heart attacks in the past, there's so much long-term benefits that people can get from lifestyle modifications, which usually involve diet and exercise, but they clearly can have really good long-term benefits.
Yeah, all right. We are in a society that really depends on medication. Explain to folks so we don't misunderstand what medication is. It doesn't mean I'm gonna take my pill and have a box of donuts because I took my pill, right? Medication has its place.
Right, there's several heart medications that were studied, and we know they're proven. They work really well in people who have had heart disease, heart attacks, stents, or even weak hearts. Have a lot of great benefits. They've been studied in thousands of patients, but really it's almost as if it works together well with lifestyle modifications. Yes, medications can do well, people can live longer, but the lifestyle modifications can really give people a better track to have less symptoms and maybe even take less medications one day as well.
Yeah, and that's one of the things a lot of your patients will ask you, how can I take fewer medications? And a lot of people also want to take, can I just do more natural things? Can I take more fish oil? There's nothing wrong with those things, but you really got to have a conversation with your doctor if you're talking about doing things in lieu of.
Right, exactly. I mean, I have plenty of patients who come with me and they are on easily 10 medications, even more, and they say, how can I take less? And there certainly is a path to take less medications with lifestyle modification and diet, but also alternatively, people are willing to take multiple of these natural supplements, which are good. They do have a role, they can be beneficial, they're often promoted, but they don't take the place of traditional medication. If you really want good long-term benefits, they need a diet and lifestyle modifications as well.
Yeah. Here at Modern Heart and Vascular Institute, you kind of have a two-pronged approach. One is, let's be preventative. Let's see what's coming your way so we can head off a heart attack, because you literally can head off that heart attack from coming. But a lot of people come here after they've had a heart event and have to do those things to make sure they stay healthy. For example, this room that we're in right now is where people will come to do some rehab. Exercise has always played a role, but it especially plays a role after you've had that event.
Exactly. Here we have a cardiac rehab program. It's actually one of the few in Houston that has an intensive cardiac rehab program. So we actually have an significant exercise component. Usually a 12-week program. People have to come 3 times a week. But people who have heart disease, sometimes they may have back problems, knee problems, things that may limit the exercise component of it. But we have stationary bicycles, arm exercises, things that still allow people to exercise even if they have other health issues as well. But in addition, with our intensive cardiac rehab program, we also have a significant component of diet and lifestyle modification. We have an excellent dietitian and cardiac rehab team, which help people to get ideas of how they can eat healthier, cook healthier, and help them apply it into their lives.
Yeah, and that's the great part, is with that registered dietitian to help people apply it into their lives, because old habits are hard to break, but they can sit with somebody and explain to them what works for them, and also work within their palate of what they like to eat, because they're more likely to eat it that way.
Exactly. You got to create it in a way that somebody's going to stick with it for long-term benefit. No crash diet, no quick fix is going to really give people long-term health benefits. So you have to kind of figure out people how they can better adjust it, how can they apply it into their own lives.
Yeah, you said no quick fix, darn it.
I know.
In general, how long does it take before you start seeing improvements if you stick to that eating plan and you get the right amount of exercise in?
Usually I start seeing a health benefit about 3 months for people who can stick with some of these diet and lifestyle modifications. Usually at about 3 months, yes, people may see some weight loss, but you also start seeing improvements in blood pressure, improving cholesterol markers, until you reach the point where okay, let's address your medication. Let's see if we can actually take less medication because the patients are doing something. It's not like I'm just automatically taking off the medication. They're putting in the time, they're putting in the commitments until they earn a right for less medications if they can stick with it and reach those markers.
Yeah, a lot of us have a tendency to come in when we can't stand the pain anymore or can't stand a symptom anymore. The problem with heart disease is sometimes the first sign of a heart attack is the heart attack itself. Who should get screened?
A couple of things to allow for screening for heart disease. Obviously, a family history is always very important. People who have had family members who have had heart attacks or bypass definitely need to be screened for heart disease. But then there's other common risk factors, which include things such as high blood pressure, diabetes, obesity, those are all really strong risk factors to develop heart disease or potentially have a heart attack one day.
Yeah, and I got to tell you, if you have any of those things that Dr. Morales mentioned, come in and get checked. I did, and I was nervous at first, but then everything was all clear. So what that did was it gave me a great peace of mind. But for my parents, it gave them the next step of what to do, and it added years to their lives. Thank you, Dr. Morales.
Thank you very much, Debbie, for having me.
Remember, a screening at Modern Heart and Vascular Institute can actually determine if a heart attack is about to happen. To book an appointment with a board-certified cardiologist, visit them online at modernheartandvascular.com or give them a call. Here's the number, 832-644-8930. That's 832-644-8930. Appointments fill up fast, so contact them today. By the way, they have doctors who are fluent in Spanish. They have several locations. Their Woodlands location is opening soon.